in our view, we still have some things that we see in our industry we need to really look at and communicate about and try to improve. And I think Steve Cottrell's own frustration with out of state providers is exemplary of that. So even now we encounter issues where there's not full understanding of how even the testing rules work, particularly with regard to remediation. Sometimes there's a misunderstanding between how the rules might apply to edibles and topicals. And these will be topics we'll continue to talk about, but this is where we can hopefully work some of that out. And we especially want to be able to have some kind of way to, however it can happen, get word to our inspectors with regard to any advice or feedback we may have to help them make better decisions, because sometimes they may not have the full suite of information. And we'll speak to that in a second. So I just wanted to thank everybody. We want to make sure that we can make a contribution. I brought in Brandon Ham from my team to present for me on my behalf the several presentations we have here. He's the expert in this. He's a little nervous, I'll tell you, but I'm going to turn it over to him delivering.
Do you want me to share the screen in the meeting so they can see the slides as you go over them? Or if you're in the meeting, you can share them as well.
I'm not.
Okay,
that would be
just
great.
kidding. I will share for you.
Thank you.
While she's preparing the slides, I'll reiterate and just say thank you for the time and opportunity to present the topics that we prepared for today. The opening one regarding potency calculation is just to express some of the confusion that we've experienced out in the market.
Yep, everyone just give us one more second. We're gonna pull the slides up on the screen so everyone online and in the room can see them.
Really kind of disappointed I can't see Steve Cottrell's hair that I had on today and not on video. Hear that, Steve?
Okay, I think we got the slides up. Can everyone see them?
Yes.
Okay, perfect. Thank you. Okay, go ahead.
All right, so we'll just open up with the agenda of this slide presentation. We'll briefly cite our 917 through 1701, table 3.1. After that, we'll discuss how the language is being translated in the marketplace. I want to call out, we're not here to shame or cast any judgment. It just highlights the confusion in the room for improvement that we're experiencing. After that, we'll show the impact of the two different calculations that are being used by receiving inventory and compliance teams. And then we'll show some guidance that was provided to our team and some language about how we think this might land clearer. So slide 3, I think we're all familiar with this table or with this language. This is from table 3.1 from 317.01. Section E, potency. Under labeling, it states if a label claim is not within plus or minus 20% of the tested value, the required action is to revise the label as necessary. On the next slide, we get into, let me just say, I've used some uncommon notation here to kind of encompass the calculations just for the sake of space and clarity. LC represents the label claim, TV represents the tested value, and the funny E or not to E symbol with the squiggly brackets is notation to represent that a number is an element of or within a data set. That data set being the plus or minus 20% as a range. And just to, actually if we can go back up. So just to briefly show calculation 1, which we understand to be correct. If a tested value is within the data set of 120 or 1.2 times the label claim or 0.8 times the label claim, that is a compliant test result. If it's outside of that window, we understand that to be non-compliant. The other calculation that's being stated out in the market is rather how it's being translated is that the label claim needs to be within the data set of 1.2 times the tested value and 0.8 times the tested value. And that's what would make a compliant test. And then anything outside of that would be non-compliant. And we'll show the way that these two different calculation paths present themselves on the next slide.
We are talking about edibles here, just to be clear. Correct.
In general. Edibles, it's impactful too directly because flour, concentrate, you get that tested. It's easy enough to label with what you receive from a test result. In edibles, we oftentimes label ahead of time. We get all of our packaging generated, and we're trying to place in the market according to a stated label claim.
Consumers expect to buy their products, particularly topicals and edibles, with it having the amount of marijuana in it that you're claiming. And sometimes the labs are 100%, sometimes they're not. And there needs to be a vehicle to address that remediation when it's not altogether clear the problem.
So in the next slide, we show an example one. We have a brownie, we'll call it, with a label claim of 100 milligrams per unit. We receive a C of A back with a result of 81 milligrams per unit total THC. Using calculation one, this product would be dispositioned as pass or compliant because 81 is within 80% and 120% of 100 milligrams. In calculation two, this would not pass. It's actually wildly different because if we calculate 80 or 120% of the tested value, the window that we have there is 64.8 to 97.2. Therefore, 100 milligrams does not fall within that number. This is just another slide that presents if we had a C of A that showed 125 milligrams per unit total THC on a product, and the label claim was 100 milligrams THC. The first calculation, the one that we understand to be correct, it would not pass because it's outside of that 100 or outside of that plus or minus 20% of the label claim. However, this product would pass the second calculation because we would be taking 120% down to 80% of the tested value of 125, 100 being at the bottom of that range. So we asked the universe for some guidance. Lo and behold, the department came through, and we have this image that's in front of us now that helped us to really clearly understand how we calculate potency or percent variance as it would be. It was helpful, it was appreciated, and it certainly lent itself to how the language should be used to calculate potency for compliance. And then on the last slide, what we've done is we put together the language in blue represents language that we would suggest using that previous slide, the language that was provided to us by the department to clarify that labeling section of table 3.1, section 8, to help everybody understand a little bit easier how to calculate this for practical purposes. That's what I got around this slide.
Should we make a motion?
There was an issue with the recording at the beginning of the meeting. I was wondering if the council would mind doing roll call again so that we can have it for the record.
Yeah, we forgot that one, didn't we?
We'll do that during the meeting wrap up so we don't interrupt the presentation and any resulting motions.
Are there any questions around anything that was presented on these slides?
So reading, I have a question. So as I'm very detailed, just presentation here, guys. I applaud you for that. But are you asking to change the potency requirements or the reporting requirements? What is the no?
Explain the problem and why we need clarity.
So in simple terms, if you go back to slide 3, the way that it reads now, label claim is not within plus or minus tested value. If I read that is label claim equals or does not equal 0.2 times the tested value, then I'm using calculation 2 effectively. What this doesn't state clearly is that we're calculating a potency percent variance, right? As is qualified on the second to last slide. And so what we're doing is trying to clarify this language so that that can't be misinterpreted as a word problem in that way.
And just to be clear, this has been a problem. We had we got different answers from different folks. Some of who changed their answer based on talking to others. And so in the interest of clarity, we'd like to recommend an addition or minor change to the language about labeling as a result regards to this current slide that's displayed. So I'd like to make a motion that the board take it, or the committee take it under advisory to consider including this with any other additional recommendations they choose to make in the future.
Before we move to a motion, Murray, I just want to check in with Steve Baker and Mary Cornell and see if they have any thoughts on this.
This is Steve. So the whole reason why we did this was because the label is not the definitive number. And we wanted to make sure that the label wasn't driving the testing. And we see that to a point today. We see where labs are told our flour has to be 20% and our concentrates have to be over 90%. And there's this expectation that the results have to be a certain result. What we were saying, and the exact reason why we put it the way it is the result that is scientifically valid and defensible is the result that's coming from the laboratory. And so that is the result. And whatever the label is, I know that for edibles especially, you like to label the product and everything, but the only real number is the result from the lab. And the reason why we put the 20% around that result was because that is the number. So it was intentional to do what we did. If the committee wants to do something else, then that's fine. But then you're driving the result to what people want it to be on the label.
And that's kind of, I wanted to make sure I was on the same page with Steve, but it is the 20% of the tested value. It has to be within. And if you're not experiencing that in the field, then let us know so we can make sure that we train our staff appropriately
Right.
if that is an issue.
We did in fact run into this.
Okay.
Yeah.
Like it is the tested value.
Correct. And so there was some confusion, and sometimes we hear about this a little after the fact, and that's painful because it affects orders. Brandon?
So as a clarifying question then, I just want to be sure that we are calculating 20% of the tested value and whatever is within 20% of that. So just to be clear, that stands contrary to what we just presented, correct?
Correct.
Okay.
So for example, if you get a result of 80, I know you did 81, but I can't do that exactly in my head.
Sure.
If we use 80 as the result that comes back from the lab, then you have 20% on either side of that to label your product, which could be 96 on
Right.
the range. And I always mess up on this one. 64, I think.
Yep.
Okay, so that's what we intentionally wrote into this.
And again, if you ever experience an issue with that, where you're being cited for something that's not correct, there's a couple avenues to go down. One is to definitely contact our team, contact Daryl and Jason, and they'll work with their teams to make sure that we're all on the same page. On the second availability to correct an action like that is we have the informal dispute resolution. So if you're actually cited for that and it's not correct, you know, that you're within that testing value, then you submit the informal dispute resolution, provide that narrative and that documentation that goes up to me, it goes up to my boss, Tom, and we make sure that that statement of deficiencies is correct and that no citations remain that shouldn't at that point.
Megan, half of the industry is calculating it one way and the other minor minority is calculating it the other way. So before you ask the industry to do it this way, should you make sure your inspectors are understanding how it's supposed to be before everyone has to make a change?
So
Because it's different.
we
in the
will
field.
ensure that they're doing it correctly, but I mean, that is what's in the rule. So that's what should be done. And sometimes your value would be correct either way you calculate it.
Right.
Sometimes it would not.
Correct.
But again, the rule as it stands is the plus or minus 20% of the tested value. So again, if we have an issue here, absolutely, we will take steps to train and correct on that. But I can tell you, I've never seen an IDR for this. So no one's ever brought it to my attention through an IDR that they were cited based on the incorrect interpretation of
One of the
that.
things that does happen.
So if I understand correctly, what we're saying here is a claim of 100 milligrams of THC and a tested value came in at 80 milligrams, that it's going to be, that label claim is going to be incorrect because 20% of the tested value is 96 milligrams. Is that correct?
That is correct. That
Okay.
should be cited.
I was just gonna add that, particularly as an edible manufacturer, we don't have the same routes to the state. And it's very common for dispensaries when an inspector goes in, sees something they don't like, they'll write it up, and that customer stops ordering product. And they're crazy busy, so they don't necessarily have the time or take the time to communicate with the supplier. They just take it off the shelf and stop ordering it. So it can be really challenging for them to even take the time to fill out a dispute resolution. And how important is that to them as a retailer? So it can be challenging. So when we hear these things, it's disturbing, but we'll take it on your advice to make sure we use the resolution process.
Absolutely. And knowing that you've brought it up here allows me to make sure we address it with our team here, as well as the associations and things like that. We can make sure that everyone is on the same page. So that's where the benefit of this meeting. From here, we can take it from there. But I think most people in this room have a direct line to myself and my team. So you're always welcome to bring stuff up to us if you think something is going wrong.
Thank you.
Absolutely.
Thank you for the clarity.
Absolutely. Thank you, Steve.
Okay, we're ready now, if it's okay. No, we're not going to make a motion. If it's okay with Victor for us to go to the next presentation. Great, thank you.
Okay, starting with the agenda, slide 2. Similarly, we'll discuss scoped in for clarity, language used in the rules. We'll look at table 3.1 under the required actions column, discuss some interpretation conflict that we've encountered. We in fact don't have necessarily proposed updates to language, rather just to highlight some of the language. Some additional considerations and then some hanging questions that we have as a result. So beginning with table 3, section 317.01C calls out a retesting pathway. It does not exclude any of the analytes or any of the tests that could possibly be run. It just states that no more than 2 other laboratories that are independent of the one that conducted the initial test that are approved by the department can then subsequently test that product from the same sample that was originally submitted within 7 days. From there, we move into table 3.1. It's just worth noting and highlighting that in table 3.1, none of the required actions within table 3.1 offer a definitive line to just retest. There are the abilities to destroy, remediate and retest, and then relabel, obviously, and section E for potency. So we recently had a TA session and we suggested or we were looking for guidance on how to employ the retest pathway for edibles on potency in particular. And there was unless one of the pieces of guidance was unless the required action column in table 3.1 states retesting isn't necessarily an option. Based on the rules that we just reviewed in the previous 3 slides, that's not necessarily true. Potency isn't evaluated as a pass-fail, therefore there's no reason to retest for potency. We do understand that potency isn't pass-fail, it's compliant or non-compliant as it relates to the label claim. However, based on the way that the market shops, it is relevant for us. We see it as a pass-fail against our own processing. Marijuana products only have the ability to be relabeled if they don't conform to table 3.1. That is to say they don't fall within that plus or minus 20%. And that table 3.1 is the sole determinant for disposition. And if that is the case, section C of 317.01 is truly moot at that point.
Is it okay if I clarify, or do you want me to wait till you're
No,
done?
by all means.
Perfect. So the actions in the table, the required actions, those are if you completely fail testing. So when you look at the retesting language in subsection C, that's if you fail one of those first tests, then your next step is you can ask for that second and third retest. And if you pass the second and third, you're good to go. Now, if you fail either the second or the third, then you've failed. And at that point, that's where you can take these required actions. And if you remediate, then the retest there is actually doing a whole test again. So these actions aren't really related to subsection C. I just wanted to clarify that they're actually completely separate from each other.
Great. And this is how we understand it as well. Slide 7, the ability to retest as written by 317.01C is applicable to all analytes. That does include potency, pesticides, micro, heavy metals, and residual solvents as identified in table 3.1. It's important, I want to state that it's important for us, especially with edibles, that there's no recourse for us without the knowledge of what the source of the issue is. And oftentimes, if a lab, and by example, if a lab makes a mistake on a sample that they've run, we don't know that, and there's no way for us to take action against that. All we can do is look internally and try and solve for our own processing the best that we can. Retest currently provides a pathway for us to move forward to make sure that we're providing the most accurate result possible to the patients and consumers as end users.
I see Steve, you have your hand raised. Steve Baker, please unmute and respond, please.
So I might be reading this wrong, but potency is not an analyte that can be retested. It is what it is. In the very first meeting in the fall of 2019, we went through this, and when you get a result of potency, that is an objective number within a certain percentage. If you're going out and it's part of the shopping problem that's in the nation, if you keep looking for other numbers out there, there's no reason to believe they're as objective as any other potency number. And that's what we were trying to explain, is the reason why retest was not an option in table 3.1 is because it was not included as an option for retest. If you don't like what the potency is, then I don't know what to say about that, because if the laboratory has done the testing and has met all the quality assurance, there is a certain range of, and I know labs have submitted multiple samples of the same thing to the same lab or different labs, and there's variations. That is true. That's the 20% we were talking about for the technology. But if you're looking for the lab that just happens to have a bias on the high side, what makes that any more objective result than any other one? And so what we said in the beginning is you should choose a lab that you trust and go with the numbers. And
Well, that's all exactly right. Except that even the labs we trust sometimes get it wrong. It happens. And it costs thousands and thousands of dollars. Without a method to remediate by allowing for an additional test, that's very expensive for our industry. It affects thousands and thousands of units. It impacts supply chain. It's a real pain. I mean, I would love the labs to be all the same and to be able to trust them 100%. And God, we try, but their sample prep mechanisms are not consistent. They don't use the same equipment. They're just variations in it. And we have lots of conversation with lots of labs, and we like them all. But frankly, sometimes they don't do things the same way. And the variability on testing. I'm looking through 1,700 records of testing data from the last 6 months, and it shocks me how much the labs can vary in terms of their variability. We've even gone out and done studies, say in Brownie, just for giggles, to 5 different testing labs just to see what the results are. And by God, that 20% is important, plus or minus, because we'd be sunk without it. So we would argue that potency is one of the things you can retest for in edibles because of that variability. And we're happy to spend the extra money if it means getting a juice product out or something like that, we actually can remediate before we bottle or before we finish the batch.
I think the same goes for flour as well. For far too long, there's been too many laboratories that will buy their business via higher results because they weigh heavy and report lower numbers. I've witnessed it personally.
As I understand it, we don't have a choice about who our second and third labs are.
We
Correct.
do. We do. But what I'll say is, nowhere is the language clear that potency is not able to follow that pathway of retest the rules. Per Megan's statement to begin with, table 3.1 isn't the determinant for what is available as a pathway. That's separate from section C.
The lead in for subsection C says if it failed in the analyte, then you can do this pathway. So it's the lack of failure language with potency is why currently, the way the rules are currently written, why it doesn't apply to potency. But again, if you guys have a motion towards that, then absolutely, that's the purpose of this council.
Yeah, and I think that, to further clarify some of what Murray's saying, getting 2 additional labs to test after the first lab, because they are all certified and they do all have these QA programs, does bring statistical relevance to those second 2 labs that did in fact qualify something as passing. And we're not lab shopping. We're not sending multiple samples off to different labs and then choosing a lab. We're trying to follow guidance that's presented in this way. And so,
one last point, more often than not, our retests come back with passes, meaning we met the criteria, but our initial first test said no. So, there's a problem.
and we've had
Can
our
I make sure I didn't mean to interrupt you, Murray. I just wanted to make sure I understood correctly. So we're basically saying we do a test, 100 milligrams is what you're expected. That's what's on your label. It comes back 70 milligrams. We're outside of the 20% ratio, and they won't let you retest that. So that way you can continue to use your standard packaging at 100 milligrams. Is that what we're talking about?
We are, but we're also asking to be able to have a means to retest to verify that in fact the number was 70. Yeah.
I mean, I would agree with that. I know that you guys put a lot of effort into having a standardized product. Labeling is standardized. You buy hundreds of thousands at a time. And if a particular batch doesn't meet the standard, I'm totally with retesting it and see if it can meet the standard. If it can't, then, you're going to have to substitute a little sticker on that label, but I'm with you.
And in fact, that's what we do now is we label over the top and we reissue them at a different, but that's not what consumers expect. They don't want a 90 milligram brownie when they're looking for 100, and don't get me started on bioavailability and how much little of this stuff actually makes it into our system. But the reality is we're trying to hit the targets that we tell the state we're going to, and we would hope that this retest capability would be appropriate. So I'm going to argue, are you writing the motion for me? Okay, I'd like to make a motion to include
Could we,
potency.
we've got another few questions. Would you like us to take those first?
Please do.
Brian?
Yes.
Can I weigh in before we take a motion?
Go ahead, Ryan.
Thank you very much. I don't, Murray, I'm not sure where you're headed with the motion, but I think it would be worthwhile to have almost an entire session on this topic, because my understanding is that there are significant variations from accredited lab to accredited lab. And I'm not sure that what we are doing now is really in the best interest of the consumer, right? If we send out a sample and it comes back at 13%, where in fact it's 19%, that might have a significant negative effect on the consumer that they weren't planning on, right? They may have got too high. On the counter side, if we get a test that's too high and it's low, then the consumer might be getting shorted. So I'm not sure the best way to address it, but I think we should put our heads together and try to come up with a better way. Maybe a set of ranges or a score. But it is a significant issue. It can cost us a lot of money, and it can be a problem for the consumer on either end. One last thing is I don't agree that we can't retest potency. I think there are a number of ways that under the rules that is viable, but that may be a conversation for a different day. So I don't know what your motion is, Murray, but I would suggest we have an entire meeting or a good chunk of a meeting on this particular subject.
Yeah, I agree. I think a range for potency. I know that it's been populated in conversations amongst the industry for some time now. Instead of a hard number of say 20%, or say 22%, the range then becomes 22 to 25% type of a
I
thing.
think we're talking about two problems too. One is we're allowing remediation at a different laboratory, and that's part of the problem that you want to discuss and go around. So we're talking about letting other labs remediate, which has caused the problem. So maybe we should also talk about making sure that it has to stay at its home lab.
Yes, please.
I think that
Can I know this is Steve. I know you all would like to have definitive numbers, and I heard somebody said, well, if the true value was this, the problem is it's hard to tell what the true values are. When a proficiency testing company makes up a standard and sends it out for testing, which all of our labs have to do annually, they don't have a value set in the beginning. This product goes out to, they have a level that they think it is at, and then they send it out to hundreds of labs. They bring back the results because there is variation in the testing. They do the statistics around bell curve, and then they come up with limits for what that would be in the mean for the testing. And you'd be surprised at the variation. And that's how they come up with numbers. I could see where you could build a database based on a mean or an average or something like that, but just seeking something that's high on the curve and everything is not necessarily objective.
So, to some of this, I want to state there have been instances where we have asked a lab to look into an anomalous result, and what we've had returned to us was there was a mistake made on their end. If we didn't do that due diligence of chasing that lab, there is no recourse for us as operators. In that way, this is why the retest pathway is important, because if we can get 2 out of 3 tests that say yes, and to Steve, I'll say we're not necessarily looking for a higher number or a lower number. We're looking for 2 results that are relative to one another, such that we can release or reject upon. And in that way, that's where the retest pathway, until there's standardized methodology provided by the state labs to feed into the rest of the industry to let everybody know what needs to be done to achieve accurate results, it's not relevant to put that burden onto the operators to soak up whatever inconsistencies there are at the lab level.
So let me just close this presentation by mentioning that I won't make a motion at this time. I think it's absolutely right that we should spend some time talking about this. So I'm going to suggest we add it to the next meeting and that we dedicate a significant portion to that. And I think anyone that's got a stake in this really needs to step up and talk about your pain points. And if you've got ideas, then bring it to that meeting.
And since any member can request to add an agenda item, I don't think we have to go through the whole roll call just to add an agenda item.
I see, Jay, you still have your hand raised. I know you commented earlier, so maybe you still left your hand up by accident, or do you have another comment? Okay, perfect.
More an accident, but I'm still thinking that maybe we should discuss, keeping the retest at the lab that it came from. When we allow them to retest at different labs, I don't know anybody particular, I'm not stating any incidences, but it provides an opportunity for somebody to try to get their business, or to, there's different methodologies, like you said. So if we're sticking with one and they need to be consistent, like you said, they need to trust the guy that they're working with, we should have all the retests done at the same place and not be able to move to different labs, because it just opens opportunity for different activity.
Okay, thank you.
We move to the next presentation.
Okay, and if anyone wants to present on this topic at the next meeting, please reach out to us. We would love to have, obviously, as much information as possible for all of the council members. And if there's going to be a motion at the next meeting, if you believe you're going to make a motion at the next meeting, if you can get that to us ahead of time as well, it's something that we can add to our agenda to make sure people are aware of it.
Okay, with Victor's motion, I'm going to move on to the third presentation on sampling. This particular topic had some discussion this last fall. And in fact, some of that discussion was a little worrisome, because I don't think we all fully appreciated some of the significant issues that could be associated with that. And I do worry that sometimes we could get a little ahead of ourselves in terms of trying to solve a problem. In particular, sampling is problematic because it can have an adverse impact on certain kinds of operations because of the amount of samples that have to be provided. And I know that there's some motivation on different parties to try to see sampling better understood and managed. We ourselves, in terms of what we do as a company, doing dozens of batches of products a week. Those batches are, usually in the thousands of units. We've looked very hard and tried to use the ANSI tables that are provided with the rules and recommended. And we found we can make them work for us, and we think they can be used for other things. So we believe the tools are there, and that's why we wanted to talk about it today. So this presentation explores that. I'm going to turn it back over to Brandon.
So we go into slide 2, the agenda. So again, we state current rule. It has been scoped just for the sake of discussion. Didn't want to call them issues, but opportunities for sample methodology improvement that were raised at the previous meeting, as Murray mentioned. Potential opportunity or potential solution using ANSI Z 1.4 to improve upon what we have. I'll get into the 2 tables that are currently being used from ANSI Z 1.4. And then a couple of examples, both measured just continuously, that is to say through mass or volume, and then some product types that are discrete measured. And then we'll close out. And so the language calls out only one sample of each batch of medical marijuana is collected collected according to ANSI ASQ standard Z1.4, general inspection level 2, incorporated by reference using one of the following methods. Well, that is what it is. One of the issues here is that there's only one sample being collected, and I remember if we go to the next slide, is one sample that gets sent to a lab representative, truly representative of an entire batch. We had previously voted on improving the language that surrounds batch to make sure that what is included there is more representative of a batch and defining that without limiting. But there is still the hanging question of, is one sample truly representative of that, regardless of batch size? And so that also gets into, does the sample size currently scale with the batch size? As it's written in rules now, that is not the case, because if I only have to send a 12-gram sample off of 1,000 or 5,000 brownies, again, that may not be truly representative of everything in that. And the same holds true for concentrate and flour. So when we get into the potential solution, within ANSI Z1.4, it states the inspection level determines the relationship between batch size and sample size. Using the sample size as the improvement for representative test sample in relation to the batch size. However, the current inspection level would be overly burdensome due to the unnecessarily large sample sizes as it relates to general inspection level 2. This will all make sense when we move into the tables. What we could do is we could shift the inspection level from general inspection level 2 down to special inspection level 1, and that would allow us to have smaller sample sizes to then send to the lab so that it's not overly burdensome as it relates to throughput to the lab or to the amount of product being sent off as it relates to the size of a batch by the producers. So in slide 6, this is the inspection levels. Currently, we see general inspection level 2 lists A through Q. In terms of if a batch, we'll say it was 2 to 8 pounds, you need to send a sample size relative to A. Currently, and let's go ahead and switch to the next slide. It's easier to reference this way. Sample A would be sample size 2. To what? If we were using relative measurements, we say 2 pounds. Well, obviously that's not going to happen because I'm not going to make a batch of 2 pounds and then send 2 pounds. So when we look at sample size, if we evaluate that as a sample is the minimum amount required by a lab, we could say, okay, if a lab requires 10 grams of a sample, anything from 2 to 8 pounds, I have to send 2 samples, 2 10-gram samples. That is a little bit more achievable in that way. Now, as we start to grow the batch sizes under general inspection level 2, if I could ask you to switch back to that last table. Let's say that we're making 1,000 brownies, by example, or we have, 500 pounds. That's going to be general inspection level under general inspection 2, sample size J. So when we go back to the table 2A, sample size J is then 80 samples. Well, I can tell you, I'm not sure a lab would be pleased to see 80 brownies come through or 80 individual unit samples of 10 grams apiece in order to satisfy the need to grow that representative sample to something that is or closer to being representative of the batch. So that's where we say if we use special inspection level 1 more time back to the last table. Last time I'll ask. The most that we're going to see come through is up to sample size letter D. And as we reference back to table 2A, D only takes us up to 8 samples. And so anybody who's making a batch that size, 8 samples is not a terrible amount of strain to that operator. Now, one of the things that we wanted to evaluate then, and again, I'll say that there has been some suggestions that were passed along to us about how to further use ANSI Z1.4. My understanding of the standard is not all of that strong. Merely what we are offering is just a step forward using the guidance that is already in place to improve the sample size so that it can be more representative. Other experts and people from other areas of the industry are going to better understand the impact to them. By example, I don't know what a standard batch of concentrate is, so I can't make an assessment. So what we've done is put together some ranges based on what those sample letters would be. 2 to 50. And so we'll go into it for flour. 2 to 50 pounds would be 2 samples of 9 grams apiece. And I'm using minimum sample sizes that are with the lab that we work with as a regular customer for the sake of just putting these examples together. When I evaluate what that sample size is representative of against the batch, that's what I have over in parentheses. As we go through this, I won't bore everybody walking through it line by line, but if everybody would take the time to kind of review this to understand the impact to a batch based on the sample size that's being called out in S1, where it may not be a perfect model, it may be a step in between what we had with one representative sample and what we're trying to work towards in gaining enough of a representative sample that scales with size of batch. And so that's really what I have. As I mentioned, I don't want to go through all of the samples independently. I'll leave that to everybody else. Really, this was to stimulate more conversation around this as a potential path forward and to solicit input from stakeholders around the table and throughout the industry to put our heads together to solve this, because we recognize that we need to have more representative sampling.
Thank you. Ryan, I see your hand raised. Go ahead, please.
So I think I'm following this, but if you could maybe try to dumb it down for me a little bit in elementary school summation, is what you're suggesting that instead of a larger sample size for a larger batch, we actually do a larger number of samples of a smaller size. Is that accurate roughly?
Yeah, it's a larger number of samples relative to the minimum sample that is requested by the lab. Yes.
Gotcha. And so then they would homogenize that instead of treating them like different samples. Gotcha. Yeah, I mean, I'd like to think about it a little bit more and talk to our folks, but that sounds like it makes sense to me.
You know, I think one thing we can offer is come back and show a flow chart of how you'd refer to these two tables to get the numbers that you would be looking for.
Yeah, side by side.
Yep. That includes our contribution. Thank you very much.
Okay. Thank you.
Thank you guys very much for driving up from Tucson to do this. We really appreciate it. That's
Betcha.
a lot of work you put together.
Okay, I know we're almost 10 after 4, so we'll keep moving here. We've got a few items left here. And next up is Jay Neary. He's going to talk about aspergillus and medical, CV medical as opposed to pass and fail.
Thank you so much for the introduction. My name is Jay. I don't have a scientist like Murray. That was really amazing, Murray. You're really detailed, and so I didn't come up with a presentation like that, unfortunately. But I'd like to just kind of put the thought out there. Maybe we could tag it for an agenda item next week where we can get into more detail about it. But just in my recognition and testing samples here in Arizona, I do the Earl Cup twice a year and test a good 500, 600 samples each time. I get a little bit of an idea of what you guys are going through. And we have this new machine, the rad source machine, which neutralizes, kills the aspergillus, and so that's being used heavily. They have a lot of clients here in the state. So, maybe wanted to talk about possibly changing aspergillus from a pass-fail to maybe a rec medical designation. So if it did have aspergillus, it could only be sold in a rec situation. And if it didn't, then it could go to a medical designation. Or maybe we talk about testing for the mycotoxins instead of the aspergillus, go for what the problem really is instead of, the basic overlining. Because, we've had this problem for a long time. It's in the air, it's in everything, especially if you're growing organic. And, in other situations, it's acceptable to have a certain amount of it. So maybe the pass-fail to a rec medical designation would be something to discuss. And then, maybe the mycotoxins, I was hoping we could expand on that in the future. I know it's not an exciting subject. Anybody interested in maybe talking about this again?
Hi there. This is John Washung. I just raised my hand, but I guess nobody's monitoring. I think that the issue with mycotoxin is a great one because when you have aspergillus, you can do remediation and then you can pass aspergillus test, but the mycotoxins are still present in the samples?
I think it's a great safety concern. I think it's something that does need to be addressed because as we get more of, and as we become more of a mature marketplace, this is becoming more of a relevant conversation. We're seeing aspergillus and or mycotoxins more frequently. And quite frankly, mycotoxins are toxic. They truly will hurt the body, where aspergillus can be remediated and can be, removed quite easily.
Max?
Okay, I have a question. So, what is the detection rate of aflatoxin right now? I mean, is there any, does the state have any statistic? Do we, how often do we see it in the result? Aflatoxin. Yeah.
Steve, do you have any, or Mary, do you have any data on that?
I don't have specific data on that. I do know I used to work at the Department of Agriculture in the Ag Lab in the late 1980s, and don't judge me based on that. But at that point in time, we were having problems with aflatoxin in milk. And they were dumping tons of milk and everything. And they went out and did studies, and they found it was because aspergillus was growing under the tarps on cottonseed, which they were feeding the cows. The problem was aspergillus numbers does not equal the amount of mycotoxin we found. Just because there's aspergillus growing does not mean it's producing mycotoxins. And that was why in the very first meeting, there was a link trying to be made between the amount of mycotoxin with aspergillus, and that's not correct. What we found in Department of Ag, and Doug Marsh, the director over there, would be good to talk about this, was the higher the temperature, so you could almost draw a ring from Yuma about every 50 miles out, and the level of mycotoxin was higher in the Yuma area for the same amount of aspergillus, and was almost non-existent in Safford because of there wasn't extreme levels. So in the normal growing operations in the marijuana industry, you don't get, and there's even some of this data with the American Public Health Laboratories. You're not expecting extreme situations, so you don't see a equivalent level of mycotoxins to aspergillus. It would take thousands, if not millions, of aspergillus cells to produce 20 part per billion of aflatoxin. And there's a distinct reason why we have aspergillus versus mycotoxins. It takes a very low number of aspergillus cells to infect as a pathogen on an immunocompromised person in their lungs and have it grow. And that's the problem with aspergillus. With the 4 species we're looking at, you actually get a pathology of where it's growing in the lungs. On the other hand, the mycotoxins is a different problem, and that's because it is highly toxic. It's one of the most highly toxic things out there. And the reason why, if you look at Colorado and how it's put, we only look at it if it's been concentrated. We don't look for it in flour because you wouldn't expect it to be up at the higher levels in flour. But if you concentrate the toxins, you might end up with the levels in the concentrates and everything. So that's why the rules are worded the way they're worded.
Okay, thanks, Steve. Sean, you've got your hand raised. Go ahead, please.
Yes, I'll just second what Steve just added. There's 2 points here. One is the amount of the aspergillus does not equal to level of the mycotoxin. Because some of the strains of Aspergillus, they are like poor producers, and some of them are high producers for mycotoxin. As a matter of fact, some of the biological control things that we're doing here in Arizona in cotton is we're using non-producers, non-toxin producers as biological control to reduce the mycotoxin level in the agriculture. And the second one, the point Steve made was the fungus and the mycotoxin difference is the effect, the impact of them on immunocompromised and healthy individuals.
I want to add 2 points here. Yeah, first of all, I agree with what you just said. Positive, just 100%. So, point number one, there are more than one mycotoxin, right? Aflatoxin is just one of the mycotoxin, and in legal cannabis, based on a study that I did last year, the rate of aflatoxin detection in legal cannabis is extremely low. Like we have a data set in California. We look at 8,000 samples that were sent to combine test, 5,000 flower sample, 3,000 extract sample. I think there are 1 case of aflatoxin detect. That's it. Out of the entire year, 8,000 sample. On the other hand, Fusarium mycotoxin. Now this one I would say is a potential concern for 2 reasons. Reason number 1 is not no state in United States and no country that I know of right now require Fusarium mycotoxin testing. Right, so this is a gap in our regulation. And on the other hand, in the plant pathology literature, Fusarium disease, Fusarium head blight, like this is coming up and one of the more common plant disease that we will see in cannabis. In fact, there's a study coming out, I think it will come out anytime now, a survey of cannabis disease. And Fusarium disease is one of the top disease in cannabis in the US across all regions, right? Over 160 samples. So I guess, I just want to make it clear that I don't link Fusarium to mycotoxin because there are more than one mycotoxin. And, it's just important to realize the difference between.
And I know it was brought up that to have a difference between adult use and medical. That's exactly how we wrote the rules, is that you wouldn't have to do aspergillus in adult use. But I believe that was changed either by a vote by this committee or council so that there wouldn't be a difference. Or it was in the legislation. Megan, do you remember?
I believe we did have a recommendation from the council to have the rules aligned in both areas for multiple reasons, because most of our operators are operating under both adult use and medical, as well as we know that the risk with aspergillus is really for those immunocompromised, but there of course are adult use consumers who are also immunocompromised. So I believe that was the reason that we moved to align them. And also I think there was some risk too when somebody would test for medical and then have a failing aspergillus result and know that it failed for aspergillus and then turn it into an adult use only product to be selling something that they knew had failed this testing. So I think for all of those reasons, we did have a recommendation, if I remember correctly, and somebody correct me if I'm wrong, and that is what did move to change the rules then.
Okay, I think we got a couple of items left if there are no more questions. They look pretty similar to what we've already discussed, but I'll open it up for a second to Matt Lascala if he's any more comments on those particular items as he was listed as the person for those. Matt?
Thank you. Yeah, we pretty much touched on it. Was really my concern was to more spark the conversation around the remediation testing and the specifics of what can be done. And I think that we've already touched on that. Potency was definitely a concern and what triggers that retest. And obviously the mycotoxin is a concern as well. So No, I think we've covered that. I think we've stated the importance of it. I just want to make sure that we make some time for it, to Steve's point, in the next meeting, that we could, actually, work on, something emotionable.
Okay, perfect. Thank you. Okay, I think we're down to our last item here. And I think that's you, Fabiola, which is a review of the MTAC report.
Yeah. This is just a review of the citations issued as related to testing. And I'm gonna just go over, not on our website yet, but for the people here, and I can also share that one actually, the summary for our top 4 for establishments and our top 4 testing violations for dispensary licenses.
So these are the same reports that you've seen year after year that are required to be a part of our report. However, we've discussed in the past that just seeing a simple list of what the violations are doesn't give you a lot of information. So one thing that had been requested in the past is we let you know what citations we're seeing most frequently. So that's what Fabiola is going to share with us today.
So I know it's really small, but these are the top 4 so far this year. And then the bottom chart has the count of those rules. So our number 1 most cited was R9-18-311A1. And I don't know if you guys want, am I not sharing? Nope, not sharing. Still sharing.
Yep, just give us 1 minute. We're gonna pull those up and share them on the screen so that you can see them.
We'll also make sure to post this so that anyone on the call, both members and members of the public, can view this and see this information.
So
Compared with last year.
the last year's is still on our website, and then this current one is on the website. So I mean, you can just, but in terms of,
Is it fewer violations or more, or?
I honestly, off the top of my head, Maria, I don't know, but we can look at that for next month and report on that for you.
well, last year it was the end of year report, so it was citations for the whole year, and right now it's the middle of the
Just
year,
the
so it is less as of right now, but also makes sense. It's not done for
Can
the
you
year.
give us any insight into the one that led to a penalty? I know you can't mention who it is, but I'm just curious about the circumstances.
It would have likely been due to repeats, that they had the
Yeah,
same
same.
exact violation, and then we went back out again, and we calculate repeat citations within a 3-year window. So if you have the same citation multiple times, you're likely going to get a civil money penalty. The other thing that can lead to a civil money penalty or a notice of intent to revoke is widespread issue, where if we come into the facility and there's no test results on any product, or there's multiple products that had failed test results for aspergillus or something and are being sold, that's likely going to lead to more serious enforcement action.
So far this year.
And again, we'll put this up on the website, but if anyone has any questions related to it right now on the council, please let us know. Also, council members, if there's different information you would like us to try to provide for you at the next meeting or the upcoming meetings, please let us know that as well. And we're happy to try and pull the data that we can from our system.
That raises one last question I had. When can we meet again?
I think we're probably shooting for next month. We'll try and get
Perfect.
something on the books.
We'd love to do this monthly.
We're going to try through the end of the year to get one, and then probably wrap up in November, early December, so that we don't have to run into everybody's holiday schedules and all of that, and do the same thing where we get the report approved, and with the caveat that you guys allow us to update the data as of the end of the year.
Okay, and before we finish up, I've been asked to go through the roll call again. Sorry to put everyone through it, but we missed it in the original recording. So I'm going to go through quickly and call out your name, and if you could unmute, and please let me know that you're there. Let's start with Ryan Hurley.
Here.
Thank you. We know Ryan Tracy is not here. Steve Cottrell.
I know he was here.
Steve, I know I can see you there, so I believe you're still there.
We've definitely heard from him, so he is present.
Okay. Marie Stein, I know is in the room, so. Matt Lascala,
Present.
thank you. Andrew Provincial,
Here.
thank you. Joe DeMena,
Here.
thank you. Jay Neary.
Here.
Thank you. Vince Figuarelli,
Here.
thank you, thank you. John Guashong,
Here.
thank you. Maxwell Lung,
Yeah, that's right.
Victor Hugo Romero Sanchez,
Here.
thank you. And last call, Ty Garber, is he on? He wasn't there earlier. Aye. Okay, great. Thank you, everyone. We appreciate you all attending today. And like I said, it was good to see some folks in the room again. You're more than welcome to come here next time if you'd like to and join us face to face. Just as a wrap up, we've got several items that we're going to add to the next agenda. Retest path, potency, etc. So we'll get those listed. As Megan says, if you've got any other items or things that you would like to add, please let us know. We'll get them on the next agenda. And if you'd like to be one of those presenters on some of these items, we'd more than welcome that as well. So let us know about that. And thank everyone for joining again. And I'll turn it over to Megan for any last comments.
Yes, finally, our large training room on the 4th floor is almost completely done. So we're very excited about that. And it has the technology where we can have a virtual and in-person meeting just like this room, but it's a larger space. So we will welcome our council members to be in person, and then we will, or virtual, you can continue attending virtually because that definitely helps us get quorum and have the virtual option for our members of the public as well.
And again, for those 3 vacant positions, if you've got any recommendations, we'd be more than happy to take those. So appreciate you attending today. Thanks everyone in the room and online, and have a good rest of your week. Thank you.
Thank you all.
Thank
Bye.
you.
Thank you. Thank you. Stay cool.
Thanks.